conversation or things that are just normal things for us to know about, that doesn't necessarily mean that the people that are impacted the most have any idea
Right.
about it or about their risk. So thank you for sharing your story. As
Absolutely.
we lay the foundation for the conversation, though, since you said you had never heard of it, can you
Mhm.
help our listeners understand what is cervical cancer and why is this discussion so vital for our community in particular? What do you wish every woman knew about this disease?
Well, that is such a packed question.
Yeah, I guess it was kind of multi-part question.
Yes,
Something you
yes.
alluded to, though.
Well, one of the things, cervical cancer is those abnormal cells that are found during a cervical cancer screening. Some may call it a pap test.
Mhm.
Um, and so they're abnormal cells, and sometimes when you go to your physician, they may say, "Hey, there's an abnormality. You've had an abnormal pap. You had an abnormal screening. Come back in 3 months." Now, an abnormal screening does not mean doesn't equal cervical cancer, but it does mean that, hey, something's going on. Make sure that you go get that checked. Um, with cervical cancer, that means that those cancerous cells have invaded somewhere. They've gone into an area. And it usually would be like in earlier stages, like it was with me, because I
Mhm.
started off with 1B2 because I'm a recurrent cervical cancer survivor. It went into one of my lymph nodes, and I had to have a radical hysterectomy at the age of 41. Now you guys can't see me, but I look amazing. So
Well, people can see you because we're streaming on Facebook as well. So,
okay, okay. So, it's um and at 41 I was diagnosed with cervical cancer, and I was like, okay, well, wait a minute. So the reason why it's important is because this is one of the cancers that has a screening component, a true screening component, that it can be caught before the cancer is even there. It can be
right.
caught. And so that's one of the reasons why we're like, hey, go get screened. It's one of the screenings that will take a couple of minutes. Yes, it's uncomfortable, but it's the easiest way for us to know, for you to know if you have these cancerous cells or not. And then
Right.
they treat it earlier. Early detection saves lives. So the earlier it's caught, the more effective treatment is.
Right. And I know, just as a primary care physician, what I have found is that many times people equate the pap test or the cervical cancer screen with a pelvic exam. Just because you've had a pelvic exam does not mean you've had a pap test. They're
Mhm.
not the same thing. A pap test is one of the things that may be performed when you have a pelvic exam, but I've heard a number of patients who may have visited an emergency room and they'll say, well, I had a pap test in the emergency room. And I'm like, I am certain that you did not because they're
Yeah.
not screening for, cancer in the emergency room. They're trying to determine what's your emergency and then send you
Hmm.
back to your
Hmm.
primary. So I think there are people who may have had their cervix eyeballed or had someone look in there
Yeah.
may be confused about whether they even have had that test. So that's my PSA.
No, I love that. One of my friends, I was telling her, I said, you need to ask for a cervical cancer screening when you go in, because we think that we're going in and we're getting our annuals done and that's what they're doing. Every physician is not. And so to make it more simple, that's what we tend to say, okay, go have your cervical cancer screening completed. And even in that manner, when I told my friend about that, she told her physician, and he said, "Well, you're too young to get a cervical cancer screening." I think she was like 32. And then what ended up happening, she actually had cancerous cells that
Mm.
had to be frozen and everything. See, and I'm like, see, that's why you have to advocate for yourself. You have to advocate for
Right.
yourself.
Yeah, because I think I don't know where the communication breakdown comes. Why a doctor wouldn't know? Because there have been some changes in how often we screen and who we screen.
Uh-huh.
There are people who are too young, like people under 21, we stopped screening because
Hmm.
we have immune systems, almost universally women will get exposed to the virus that causes cervical cancer. And so there is people too young, but they be teenagers, for instance,
Yeah,
not
yeah.
32-year-olds. So
Hmm.
I know you mentioned about the numbers in terms of, well, you mentioned generally about how Black women are dying of cervical cancer when they're diagnosed. And so, I'm guessing the numbers would tell a story that would lead you to say that. Can you walk us through some of the disparities in terms of both the screening access and the outcomes of treatment when people are diagnosed with cervical cancer?
Well, what's happening with Black people, and I don't have the exact numbers, but when you look at the disparities, what's happening is Black people are being diagnosed at a later stage. That's why you see a death. Um, Now, Hispanic people are diagnosed more. Like it seems like they have more diagnosis of cervical cancer when you look at numbers, but Black people are equated to death and cervical cancer because we're being staged later. So and I think a lot of times what ends up happening is we will self-diagnose at home. So, I remember when I was originally diagnosed with cervical cancer, it was really one of my best friends. She was like, "No, Kim, something is wrong. You need to go to the doctor," because I was having my cycle every 2 weeks. And I
Hmm.
was like, "Oh, I probably have endometriosis." I don't know where I came up with that, but I just self-diagnosed myself. I never equated it to a cervical cancer diagnosis. And I think that's what ends up happening. It's especially if a person's cycle has been off, they will just continue to, especially if it's been off for years, they just equate it to that's just what I'm living with. Um,
Right.
but not going in. But cervical cancer is one of those cancers that the symptoms could be like lower back pain and all these things that are normal for us. And it's one of those things that you have to talk to your physician and be real about. So
Because
that's
that's really
why
the whole thing
it's a
with
make.
screening is like you could have no symptoms. That's why it's the idea behind screening is you don't necessarily we're trying to catch it before you have symptoms. So you might not have any symptoms at all. And even, I would say with your personal experience, that bleeding it may or may not have been related to the cancer itself. It could have been God just giving you a signal to go and get checked out because you don't necessarily have
Right.
abnormal bleeding with cervical cancer. So that was, it may be a blessing in disguise to prompt you to go and get checked out because
Hmm.
you could have symptoms or you might not have symptoms.
That's true. And sometimes you'll have a normal screening one year, and then the next year it's abnormal and it's cervical cancer. And that's one of the things too. Like cervical cancer takes years, where it's sometimes, I'm not going to say all the times, but sometimes it can lay dormant for years. So
Right.
that's why screening is so important.
I think a lot of times, people, because typically it would, most of the time it wouldn't like suddenly go from completely normal to cancer, but many times people will have like mild abnormalities that can progress. And it does get annoying to have to like keep coming back. And, we have like whole algorithms or routines of okay, if you have this abnormality then we might do this follow-up, and it could be around and around in a circle, the surveillance. And I wonder if some people get weary of that or anxious with having to keep going back through where we're trying to monitor and make sure that if there is a cancer lurking or hidden or developing that we're aware of it early and doing something about it so that you can be one of the people that has a better outcome and not die of
Right.
this
Right.
disease, which could be made rare. And it generally is rare when people are on the screening track, like doing all the follow-ups and all of that. We can many times prevent people from really moving all the way through to having a cancer that could be life threatening. So
Right.
I'm glad that we're having this conversation so people don't run from it. And I wonder too, just anytime you're talking about like gynecologic things or things having to do with reproductive, they're not like dinner table conversations where
Right,
people
right,
are talking about
right.
it. It's like, you know, colon cancer, like who wants to talk about your bowels,
Yeah,
over
yeah.
dinner? And so maybe just people being polite, it keeps important conversations from happening.
Well, I think just too in our communities, we're kind of, and I was just talking about this the other day. In Black communities, it's whatever goes on in your house stays in your house.
Mm,
And so a lot of times you're just not having a conversation. You're not having a conversation anywhere. I remember thinking when I was filling out some paperwork before I had my son, and I had to call my mom and was like, what did my grandma, what cancer did she have? Because we didn't talk about that. You just knew she had cancer, but you didn't know which one it was or anything, because it was one of those things where that's none of your business. And I think that was one of the reasons why, because I have a great big personality, but I'm not a person that shares all my personal business. It's one of those things like, if you know, you know, and if you don't, you don't, and it's none of your business, and I keep moving. But what I realized is that, especially with Black people, we have to see somebody that looks like us, because then we'll equate that, oh, that cancer is for them, that's not us. And it's like, so me sharing my story and me being open, it's more me saying like, look, this could happen to you. And especially with me, because I'm an educated woman. I had insurance. It's not like, I got 2 master's degrees. It's not like I was sitting there and I was not educated and stuff like that. However, when we don't have these conversations, sometimes you don't even know how important going to a screening is, because you think like, oh, I'm in a monogamous relationship. I was married at the time. So it's like, oh, okay, I know what's going on with my body. No, baby, go and get your screening done.
or you don't have time. That's
Yeah,
like
well,
you
that
don't have
happens
time. Like,
too.
of course you don't. You have to make time. You don't have it.
You
You
don't.
have to
You
make
don't.
it.
Right. I mean, I guess we think about all those things, and especially like when you look at screening and access, because some of it is like, sometimes people don't have time to take off work, and they got to take their vacation time. They don't have childcare. There's so many things. But
Right.
then when you look at that, and it's like, well, you also want to be here to raise your children. You also want to be here to be able to go to them happy hours and brunches. You want to be able to be here to do that. So go get your screening
Well,
done.
this is such an important conversation. Again, you're listening to the Her Health Matters radio show with Dr. Sophia Shabazz on WURD Radio, 900 AM and 96.1 FM. As we get ready to close out 2024, we are deeply grateful not only for the conversation we're having today, but for the community support that keeps this independent program on the air. Remember, it is December 22nd. Your tax deductible donation to Community Hero helps us continue bringing vital health information to you. Visit communityheropa.org/donate to support this radio show. And remember, today's question asks, what motivated you to finally make that important health appointment you've been putting off? Share your story at 215-634-8065 or toll free 866-361-0900. So, getting back to our conversation about cervical cancer, we know there's a connection between cervical cancer and HPV or human papillomavirus, but there's often confusion about what that connection is. Do you think you could break this down in simple terms for our listeners and address some of the common misconceptions that might be part of the reason people aren't getting screened?
Sure. I mean, HPV is a virus that um, affects the majority of the population. If you've had intercourse one time, you may have been exposed to HPV. It's just something that we that we encounter in our lifetime. The one thing about HPV, there are certain strands that are um, associated with cervical cancer. Um, there are misconceptions that if you have HPV, that you're promiscuous, that you started having sex early, that so many different things, and that's not necessarily true. Everybody's been exposed to it. Everybody's body is different, and they fight off viruses differently. And so that could be one of the reasons why this set of people don't have cervical cancer and this set of people have cervical cancer. Their immune system is different and those type of things. I think just understanding that it is something that everyone is exposed to. If you walk into Walmart and you look to the left and right, all those people have been exposed to it. And so it's nothing to be ashamed about. It's just go get screened and go get treated. And I think that's one of the things that we try to share with people. But that's another thing. I had never even heard of HPV, so I didn't even know to be ashamed of it.
Mm,
Like that's
that's good.
how. So I guess that was a good thing because I hadn't heard of it. I was like, oh, okay, what is that? And I think my ex-husband is the one that actually told me, like, Kim, well, okay, this is, and we both were looking like, okay, I don't know what that is. But the more I learned, I understood. And it wasn't even me learning through my physician, it was actually me learning through Survivor. Um,
Mm,
and learning, and I learned so much. And I think that was part of the reason why I was like, I got to get connected with these people because they're sharing information that needs to be told in our communities. Because how we save our communities is by sharing information, just like this platform that has been built is to share information so that we can build up our communities and they're healthier. So
exactly. And I mean, besides that, misunderstandings about that type of thing, are there other specific barriers that you think prevent women, particularly Black women, from getting regular screenings? And, what do you think we should do about it? What are some solutions?
I think the barriers are just our mindsets, our thought processes. Like, we think we're okay. The last screening that we had, we were fine. The last time we had a child, a lot of times that's what happens. So like
Yeah.
when I'm talking to people, they're like, "Oh yeah, well I was screened with my daughter and the daughter's like 16." I'm like, "Girl, you better."
Right. So many women, though, they are much more regular about getting their screenings as it pertains to their maternal health experience or
Mhm.
childbearing, and you kind of like it's as if your body has no value or use or after that, where so many people, they're not getting themselves checked. They may be getting their children checked, and
I was just about to say that.
that's I love that as a family physician, because I may be seeing the children, but I might be able to ping the parents like, hey, are you
Mhm.
taking care of
Mhm.
yourself, getting your own checks done?
Yeah, I
Mhm.
remember a couple years ago, our theme was take care of you. It was in 22.
Mhm.
And the reason why that's so important is because especially with women or people with the cervix, we tend to take care of everybody else. We got to make sure that even our mom, our dog, the kids are taken care of, and then we forget about ourselves. We're not even going to go get our teeth cleaned. It's like, girl, okay, now this year
Right.
do everything that you need to do, including your cervical cancer screening, because we put ourselves on the back burner. And it happens a lot. And sometimes it's not even that we're trying to do that. I remember not going to get my nails done, and my ex-husband was getting a haircut every week because I was too concerned about everything that was going on. And I
Right.
remember that, hey, Kim, you have to put yourself on the schedule. You have
Right.
to say, okay, let me put myself on the to-do list. And I think that's the same thing that we do just as women in general, but especially Black women. We will find everything else that we need to do besides taking care of our health. And
Right.
that's one of the reasons that we're not being screened. And then what happens is that we're going to the emergency room because we're having this breakthrough bleeding that will not stop. And then, oh, we're stage 3, we're stage 4 cervical cancer. And that's the thing that we have to stop. And we can restart today. We don't have to even wait till the beginning of the year. We can start right now on
Right.
December 22nd, and we can say, hey,
Somebody has online scheduling. You can do it
that's
right
right.
now, perhaps, or call tomorrow morning.
Log in,
Right.
schedule your appointments. I
Exactly.
agree. I agree.
That's a great one. Do you think people's like health insurance coverage tends to play a role? I know some people they may have temporary health insurance when they learn that they are pregnant, and that might be part of that whole dynamic where people are getting screened if they're, in that childbearing part of their life or, pregnant, but not necessarily have access to medical care, at other times. Is that playing a role?
Well, every state, and again, this is what I found out after I was diagnosed with cervical cancer, but every state has breast and cervical cancer coverage. So for screening purposes.
So
So
I am sure many people do not know that.
uh, and so that's a federal program. And that's something that would help them to be able to get
Okay, so
screened.
that's something that, I mean, is there like a common website or somewhere people
I
could
can
Google right now for?
well actually if you go on survivor.org, the federally funded program for all 50 states are actually on our website, and you can just
Wow.
click it and it'll
Okay.
go straight there.
Okay, so spell that for people because if some, we're saying survivor because it's like a double entendre, but it's not SUR, it's CER V,
Vivor.
okay,
CER
CERVIVOR dot org.
dot org. Mm-hmm.
Okay, you got that, people? Go online and you can find out the resources for the state of Pennsylvania and all 50 states, Puerto Rico too. I don't, we got a couple people that might be distant. I
I
don't know
feel
about Puerto Rico and Guam,
I don't know. No, I don't know about them, but
we got to double check about Puerto Rico and Guam, U.S. territories. But for all 50 states, you can go on survivor.org to get that information on cervical cancer screening, how you can access free cervical cancer screening. So that is one thing that can be off the table as a reason, a barrier to women getting the screening that is so vital. And it's I feel like this is one where we know that if we are doing this intervention, doing this screening, we can catch people before they're, beyond the point of being able to completely treat it or completely, eradicate it and save lives. So please, 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 get screening. If you have health insurance, use it. If you don't or don't know how to access this screening service, go to survivor.org to find out. Now, what about when people get in that medical setting? You touched on it a little bit about advocating for ourselves in medical settings. What strategies have you found effective when talking to healthcare providers about cervical cancer prevention and treatment?
I think being insistent, ask the questions. I don't know why when we go into a physician's office we become scared and we don't want to ask questions, and we want to, remember that's your 15 minutes.
Mhm.
Those are your 15 minutes. Go in with your questions. You can ask the questions, you can write them down. I think it's a fear.
And you
Um,
can schedule more than one appointment. That's the other thing. It doesn't have to be,
yeah.
one and done where you can never come back.
Right, right. I think with me, because I remember talking to my chemo oncologist, and I had to tell her, "Can you treat me like I've never had cancer before? Talk to me like I've never had it before." I didn't know that there was even different types of chemo. I had no idea, and it wasn't explained to me. And
Mhm.
sometimes you have to be that person that says, "Look, especially like we treat the people at Walmart when we mad because they won't go in the back and find something." You ain't got to be ugly, but you can ask questions. Say, excuse me, I don't understand this.
Right.
This makes absolutely no sense to me. Now, don't be ugly because they won't let you stay. But, you know, be nice, but ask some questions. Ask some questions. It's okay. You don't know it. That's not your profession. I've been in the social services field for over 20 years. And you can ask me some questions about IDD. I can tell you everything about IDD from the top to the bottom, but I don't know about healthcare. And so one of the things that I just had to realize is that I've got to ask some questions and I have to be my own best advocate. And when I felt like I couldn't be my best advocate, I took one of my friends with me and they advocated for me. I
That's
took one of
great.
my sisters with me and they advocated for me. It didn't matter if they're on the phone. We got too much technology now for you to
Right.
feel like that you got to go by yourself. Take a friend with you and then y'all can go to lunch afterwards. But
That's
you've got to
excellent advice
advocate.
because sometimes two sets of ears, really three sets of ears, whoever the
Yeah.
doctor, surgeon, nurse practitioner, PA, whoever they
Mhm.
are, but then also you, but someone else, because sometimes, just processing a lot of information and all of the emotions that are attached to it, you might latch on to one phrase and then miss a couple of things that come after that, sort of like being at a play where it's a real good part and people start clapping and then you don't hear the next few lines after
Yeah.
that.
Yeah. I mean,
Where,
I remember when I was originally diagnosed, because of course they want you to come into the office to tell you diagnosed. They can't tell you that on the phone. I didn't hear nothing else he said after he said, "Kiddo, you have cervical cancer." I was like, total disbelief. I couldn't hear, I couldn't think. And if I wouldn't have had somebody that was sitting with me, I would have missed everything else that I needed to do, who I was supposed to call, how
Mhm.
quickly I was supposed to go somewhere. I would have missed it all. And it's because it's natural. We're human. We're not computers. So you're going to have those emotions, especially if you're nervous, even if it's your first time going to have a screening. It's okay. Take
Mhm.
somebody with you. Nobody's going, what is the theme now? We listen and we don't judge. Don't
Oh,
even worry about that. Take somebody with
exactly.
you. Go.
Exactly, exactly. Well, this is a great conversation. You're listening to Her Health Matters radio show on Philadelphia's WURD Radio 96.1 FM, 900 AM. We are having an important conversation about cervical cancer prevention with Kimberly Williams from Cervivor. That is Cervivor. And you can find her at survivor.org. If you've overcome barriers to getting your health screenings done, we want to hear your story. Call us 215-634-8065 or toll free 866-361-0900. And I mean, we said today is December 22nd. There's no reason to wait until January 1st. Why put off for tomorrow what you could do today? Take that first step and make the appointment. If you can make it today, do it. If you can put it on your agenda for first thing tomorrow, take that first step, so that we can live longer, healthier, more vibrant lives. It's okay to put yourself as a priority. So you were talking about support systems. So let's dive into support systems a little bit more because, a person can be diagnosed with cervical cancer, then what? Walk us through the resources and support that Survivor offers for cervical cancer survivors and their families. What help is available that our listeners should know about?
Well, with Survivor, we have several support groups that so we don't just have one set of support groups. It's whatever your it could be ethnicity, it could be LGBTQAI plus, it could be, all those. We have different support groups and we have our general. And we have different meetings that we have that are set up just so that you can talk to people that understand you. It's one thing to have um, somewhere where you're talking to a cancer survivor and you're like, okay, well, at least they understand. But cervical cancer is just different. Um, and like you said earlier, the gynecologic cancers, that anything below the belt cancer, that's a whole different experience. dating and cervical cancer, like, all those things. So you have that opportunity to have those discussions that you may not have, that even people in your family may not just understand. They support you, and sometimes they just don't even know how to support you. We also have added a support group for families or caregivers of cervical cancer patients. And that's just to give them an outlet as well, because sometimes that's what happens. You have somebody, they're trying to support you, but they just don't know how. And to be able to have other people that understand, it helps, because you're like, oh, okay, that's not just at my house.
Yeah.
And I think we do that as in all other arenas. It could be even, with children. Like, I have a 13-year-old and she thinks she's grown, but then I could talk to somebody else that has a 13-year-old and they're like, oh, girl, I get it.
Right. That's
So
very true.
it's good to just be able to have those people and have those connections. And then we just try to have those educational moments. Like I said, for me, there was a lot of things. Like, I wasn't told that I had an HPV related cancer. I was told that I had cervical cancer. So it wasn't until I got involved with Survivor and then I found out, like, wait, HPV is the leading cause of cervical cancer. So I went back to my paperwork, and when I read it, I said, oh, like, and but some of that has a lot to do, and I know that you are amazing because I could just hear it in your voice. But a lot of our physicians are just not sharing information with us. And so that's one of the reasons why Survivor it's a global
Making
organization.
a lot of assumptions about, where someone's coming from, because
Yeah.
you do something every day doesn't mean that, you know, the people you're interacting with. Like, I sometimes I'm hearing these stories, and sometimes you find it hard to believe, like, how is that even possible? But it is possible. It happens, especially when you are from a community that is underrepresented in medicine. This is
Yeah.
why we know that when there is more representation amongst the healthcare providers,
Hmm.
primary care physicians in particular, this study showed that, like, for however much increased percentage of representation in a county, it added time onto the Black people's lives in that county, even if the person was not your doctor. That, like, they don't have to be your doctor, because when we're better represented,
Yeah.
we can fill in those gaps or have just more awareness. So I'm so glad that um, you're here and helping people to fill in the gaps of, like, just awareness and understanding, or even knowing what to do to even let people know that in all 50 states you can get free
Yeah.
cervical cancer screening. This is very, very important for people to know. You know, when and we talked, of course, about having conversations about gynecologic cancer, cervical health in particular. They're
Mhm.
not always easy conversations to have in families and communities. But are there certain approaches that you found work best when talking with loved ones about the importance of screening and prevention, particularly for cervical cancer? I mean, there's a number of health needs that people have, but especially for cervical cancer.
I think it's knowing your audience, and being transparent, uh,
Mhm.
having a transparent conversation. Um, it's not about you being perfect. Your story, you're the master of your story. But and when you're trying to advocate for cervical cancer screening, it's just being honest and giving facts. Like, cervical cancer is one of the only cancers that has a screening component that would prevent the cancer from occurring. Cervical cancer is one that's linked to a vaccine, the HPV vaccine, that is considered cancer prevention, and being able to frame it in that way, and be able to share it. And I've said it before when I've sat on platforms that if there was a vaccine for breast cancer, everybody would get it.
Mm.
There wouldn't be a question about it. But I think part of it, what is because we just don't receive good information, and so then we're like, well, no, that's about sex, and so I'm not doing it. But like the HPV vaccine is cancer prevention, and being able, it's all about framing how you're saying the information. You're not being accusatory. We're saving lives here.
And I think, I like to also kind of acknowledge that sometimes it's more than that, because if people are suspicious, Black people are suspicious about healthcare interventions, we got good reason to be. There's enough stuff that has happened where,
Absolutely.
you
But
know,
I think part of it is not sharing information, because it's a two-edged sword. So sometimes we're suspicious, like I was when it came to the was a COVID vaccine. I was like, I ain't getting that. That's new. I said that. I ended up getting it, but I was waiting to see the other people.
mhm,
Now with the HPV vaccine, I listened to the pediatrician. My son's pediatrician asked me, did I want him to get the HPV vaccine? I said, does he need it? She said, not really. So I trusted her. I trusted her. It wasn't until 4 or 5 years later, when I was diagnosed with cervical cancer, I got involved with Survivor. And then I'm like, wait, this is cancer prevention? She didn't explain it.
mhm.
So there's a two-edged sword to that. And that's why we have to be our own best advocates, and we have to educate. And so if we're going out there and we're trying to make sure that people are understanding about cervical cancer and screening, we have to make sure that we're educated on the topic, so that we can educate others. If we don't know, it's going to be difficult for us to educate other people.
Right. Well, looking at the bigger picture in terms of like systems coming together, how
Mhm.
can healthcare institutions and community organizations work together more effectively to improve cervical cancer prevention and support for people who have been diagnosed with cervical cancer? What changes do you think would make the biggest impact?
I think we really have to start getting into the community. So, like with this type of platform, but actually going into the community and sharing resources. I mean, that's probably even going to local churches or clubs and making sure that they understand about health needs and health risks that are going on in our communities. The more that we share this information, um, I remember saying this the other day, the squeaky wheel gets the attention. And the
Right,
more we talk about it, the more people are more going to be inclined, like, you know what, let me get this intervention. Let me go ahead and get this screening completed. Let me go ahead and let's ask a little questions about the vaccine. Because I don't tell people like, go get the vaccine, but I say research it.
mhm,
Research the vaccine. Because you don't want to say no to something that could prevent cancer for your child, but you want to make sure that you are researching, so you're making an educated decision. You want to
right,
make an informed decision about everything, and especially your health care. And if we can educate our communities, I believe that. And one of the things that I say all the time is, an informed patient makes informed decisions.
right.
What they do. But if we don't inform them, and sometimes that information comes from different places. Sometimes it's not just the physician, it's from a family friend, it's from a pastor or aunt that's saying, hey, check this information out. So
Or
we have to
in
start
your
sharing.
circumstance, it's from someone. I think your voice is so impactful. It's in many ways is more impactful than my voice, because you've been through it.
Yeah, yeah.
You have survived cervical cancer, and I think that um, I'm not sure if I've really heard many people talking about their personal experience. I think that is super, super impactful um, to, talk about it, to have more people like yourself. And it shouldn't necessarily be all on a person to disclose anything about their health information, but for people who do, it has so much weight that I'm grateful to you for, sharing your personal business when you didn't have to. Your doctor couldn't do it on your behalf, but it's something that really brings it home and makes it real for people. And then also you look good. So then people maybe are less afraid, because that is something else I think gets in the way for people, is when they're just afraid and they feel like, kind of like putting their head in the sand about it, because they don't want to be a cancer patient, or you hear the C word and immediately you're thinking the D word,
That's
and
true.
that's scary for
Yeah.
people. So I appreciate you.
Well, thank you. I appreciate you.
Well, as we wrap up this conversation, please can you share with our listeners how they can connect with Survivor and get involved in this important work? Do you have any important initiatives that you have coming up?
Well, yes, actually, we are going to have this cervical cancer summit that is going to be in our nation's capital in Washington, D.C. And that's going to be happening January, I think it's the 23rd through the 25th. But you can
Okay.
find it in our on the events tab on survivor.org. So that's CERVIVOR.org. And you can connect with us there. We're on all socials, everything, including Pinterest. We're there. Um, Sharing information about cervical
People
cancer.
probably need a diagram about what is the
Listen,
cervix. People
listen,
like, that's my
listen.
neck. I don't,
Okay, right. My spine.
it's like, I have cervical pain. What does that mean?
Absolutely, absolutely. So I mean, and we're there. Definitely, if you have any questions, you also can email us at info@survivor.org as well, just with any questions and we'll try to answer them. And if we can't answer them, we'll find the answer for you. So
Well, thank you so much for sharing your wisdom, your experience, your resources with us. Your work is truly making a difference in our community. And if you could get one woman to go and get their screening done today, or someone to tell a friend to go ahead and get their cervical cancer screening. If you know somebody with a cervix that's over 21 and really probably between 21 and 65, this conversation needs to be had. So thank you so much for that. And with that, we are going to move on to our policy and women's segment, because our powerful conversation with Kimberly reminds us that behind every statistic is a real person, a real story. So we want to take a look at the healthcare policies shaping cervical cancer care in our community as we begin our policy and women's segment. The American Cancer Society's latest Cancer Facts and Figures report reveals Pennsylvania's alarming position as the state with the sixth highest cervical cancer incidence and the fifth highest mortality rate nationally. Two critical policy initiatives could help address this crisis. First, maintaining robust funding for Pennsylvania's breast and cervical cancer early detection program is crucial. Ms. Williams talked about the program in 50 states, and Pennsylvania has a program. We know that early detection through regular screening has historically reduced cervical cancer deaths by over 50%. This program provides vital screening services for low-income and uninsured patients. Second, expanding access to biomarker testing, particularly for those covered by Medicaid, could improve treatment outcomes. This testing helps guide personalized treatment plans and can connect patients with life-saving clinical trials. Nearly all cervical cancers are preventable, with almost 100% survival rates when precancerous lesions are identified and treated early. By prioritizing these policies, Pennsylvania can work to reduce both the incidence and mortality rates of cervical cancer in our communities. So we're nearing the end of our program, and we want to touch on our last segment, our Making Moves segment, where we love to share opportunities for health-related events and community activities so we can make some moves to improve the health of ourselves, those we love, and those in our communities. We encourage you to check out Community Heroes website for event opportunities and opportunities to volunteer with Community Hero. Go to communityheropa.org/volunteer to learn more and to sign up. If you have a nonprofit organization and would like to share a health-related event for any upcoming episode, please let us know. You can email us at contactus@communityheropa.org, and let us know if you have different events coming up. And as we, round out today's program, I just want to share some important information to fill in some gaps for people because as a primary care physician, particularly as a family physician who cares for families, women of all ages, teens, people nearing, their midlife, later life, I just wanted to give an overview of the recommendations for cervical cancer screening. Yes, we know that HPV, or the human papilloma virus, is the most common, or we know that is the underlying factor that leads to the development of cervical cancer. Um, but there isn't a separate screening recommendation for people who have never been sexually active. There are, all women aged 21 and up are recommended to have their initial cervical cancer screening. If those tests are normal, then women generally should be getting screened every 3 years between age 21 and age 29. After age 30, if you've had regular screenings, we recommend generally that a woman has what we call co-testing, where we test for abnormal cells. We do the pap test to check for abnormal cells, and we do a test, an HPV test, to see if you have the risk factor for the development of cervical cancer. And if both of those tests are normal, then most women can reduce the frequency of their screening to every 5 years. And if a woman has had regular screenings as they approach age 65, it is now recommended that a woman can discontinue cervical cancer screening after age 65. Keep in mind, this is in the case where everything is coming back normal. If you have abnormalities, please, please, please stay on track with the recommended follow-up. I think, in my personal experience, we lose so many people to follow-up where you had something that could have been a mild abnormality, a minor abnormality, and it is a pain to have to go back and follow up, and different things may be recommended, or you might be working on old information. The way we did things 20 years ago is not the same as the way we do it now. And there are different recommendations, there are different treatment interventions. So please, if you have been out of the loop and you still have your cervix, or you don't know, there are women who had hysterectomies, had their uterus removed, but their cervix is still there. Please take the extra initiative to go and get checked out, get screened, because this is a preventable death anytime we can prevent a cervical cancer death. So I just wanted to add that in to provide a little extra information since we had the time to make sure we're working with current and vital life-saving information. So that's our show for today. This show is produced by Community Hero Action Group, a 501c3 nonprofit committed to addressing health and wealth disparities within the Black community. We always want to give a special thank you to Nicole Keels-Magruder, the executive producer of Her Health Matters and the founder and chief executive officer of Community Hero Action Group. As always, we appreciate the behind-the-scenes efforts of WURD's technical producer, Rhonda Gibson. During this holiday season, we know that you're finishing up your holiday planning and preparation. And as part of your holiday plan, we ask you to consider making a tax-deductible gift to support independent programming like Her Health Matters. Your investment in our community's health makes a real difference. For the past couple of years, we've brought you vital conversations about Black women's health, providing actionable tips and resources. In 2025, we're expanding these crucial discussions to tackle even more health issues affecting our community. Your support through communityheropa.org/donate helps keep these important conversations on the air. Together, we can continue to build a healthier community. So please donate today. There's no gift too small. And remember, if you have an employer, please investigate, ask whether they offer matching gifts, because you can double the impact of your gift by submitting the paperwork, not only making a gift yourself, but submitting the paperwork for your company or organization to match your gift. That really goes such a long way to double your impact. Again, that's communityheropa.org/donate. You can catch this episode and all previous episodes on our website at communityheropa.org. Thanks again for tuning in to Her Health Matters on WURD 96.1 FM, 900 AM. We'll see you in the new year with another engaging episode. I'm your host, Dr. Sophia Shabazz, signing off. Until next time, until next year, be healthy, be you, because your health matters. Peace.